Well, the first thing that I had to really weigh out is finding someone that I thought was competent, because everybody kept telling me there was nothing wrong with me.
Well, my back was hurting a lot and I couldn't stand up straight. So when I quit being able to stand up straight, I thought it was time to see a doctor about my back. And that's how I came across Dr. MacGregor.
Each patient is kind of a puzzle when you're doing the workup. So it's not only what do the pictures look like, but what is the patient actually complaining about? And, can we help this patient, or how can we help this patient? Because I always tell patients that my job is to get you better with or without surgery. Surgery should always be the last thing that we consider. Sometimes, of course, there are times when you have to recommend that as first-line treatment. But, I always say, I want to leave you better than I found you. I can't make you 20. I'm not going to get rid of every ache and pain that you have.
When she did my surgery, I was in and out that same day, and I was walking great, came out walking, and in fact, when it came to pain medicine, I didn't take them. I took one hydrocodone, I think, and that was it. That's how good she did for me.
She operated on me, and it's been about 5 years ago now, with excellent results. I felt better after the surgery, the day after the surgery, than I had for several years. No more headaches. The recovery was minimal. I think I was more fatigued from the anesthesia than in pain. But she did a wonderful job for me, and 5 years later I still have no problems and never the headaches that I used to have.
One of the things that I always, both live by and instruct my staff to follow is treat people the way you would want to be treated. Everybody gets treated with respect. Everybody should be treated like a family member. Questions should be answered. I think it's really important to spend enough time with the patients so that they know that I'm going to give them the best information that I can give them at the time, that I'm going to treat them fairly and honestly and give them my opinion, good, bad, or indifferent. But I'm not going to pull any punches. I'm going to give them the best that I can.
I would consider it a success because I don't have the pain that I had, and I'm functional.
I had a tumor in my head that required immediate brain surgery to have a shunt put in. She saved my life. It was the most awful, terrifying time of my entire life. And if she hadn't been there and figured it out, I would have died.